Okay, so the title of tonight's presentation is Reduce Your Risk. Reduce your risk of chronic disease, reduce your risk of COVID-19, basically reduce your health risk is what we're talking about. And the approach I'm going to describe to you is what I call an integrative functional medicine approach. I'm going to explain to you what that really means. So main things that we're going to cover tonight are how to optimize your health and reduce your risk of disease. So I'm going to talk about that. I'm going to talk about modern medicine, its successes and its failures. And we're going to talk about the functional medicine approach. What does that mean? And we're going to talk about powerful integrative therapies. Hence, when we combine powerful integrative therapies with functional medicine, we get integrative functional medicine. And guys, for those of you who stay with me to the end, and I'm hoping most of you guys will, so you don't miss out on some of this great information, I'm going to offer you a free 15-minute discovery call to see if integrative functional medicine is something for you. And for those of you who are already patients, I'll have another special offer for you as well. So, all right. So let's get rolling. Always, legally, I am here doing this webinar for information purposes. I am not here to offer individual advice, and you must always follow the advice of a healthcare professional. And guys, I have silenced my cell phone. I'm going to ask you to do the same. That way we can really focus on it. And again, as I said, if any questions come up, please put them in the chat box and we'll go through them. For those of you that I am new to, I'll give you a very brief background. There's a little more. There's a little video on the home page of the website that kind of talks about my story. I am an MD, trained in conventional medicine. I am an import from South Asia. My father moved the family here when we were young, and we lived the American dream. We worked hard. We succeeded. And I was blessed to have the opportunity to study at the Johns Hopkins Hospital. I trained in head and neck surgery there, and going through conventional medicine training, I started having some issues. I became hypothyroid, but they would keep calling me borderline. They would not diagnose me, and they would not treat me. And I almost fell out of residency, almost lost my marriage and my career because of lack of diagnosis. And fortunately, I got the right help and turned my life around, kind of opened me up to, hey, wait a minute, there's other stuff. And so I am always learning. I am very curious about finding better ways to do anything, and it just led me down this path. My mother was chronically ill. I had to find some help for her because, she was just basically being, told there's nothing else they can do. And she had a lot of chronic illnesses for 25 years, and that was unfortunately the way I was forced to learn a lot of this. And so I practiced ENT head and neck surgery for about 20 years, and over the last several years now, I am just practicing integrative functional medicine. So, welcome to the webinar. I'm going to start by talking about modern medicine. You see a beautiful picture of Cleveland Clinic there in the back. It's a wonderful thing. It's a wondrous thing. If you are in a car accident and you've got broken bones, my God, you want that ambulance to take you right to an acute care hospital. This is where modern medicine is phenomenal. Training in surgery, the kind of surgeries I learned and the kind of surgeries that have been developed since the last few years when I quit doing surgery are just amazing. Just totally amazing. Yet, modern medicine totally fails when it comes to the treatment of chronic disease. What do I mean by chronic disease and what's acute disease? So acute disease is like trauma, car accident, right? Heart attack. You're having a heart attack. You don't want to be seeking out an integrative functional medicine doctor. You want to go to the hospital. You want modern medicine. You want conventional healthcare. Stroke, if you are septic, if you are, if you have an acute infection and you are septic, you need the hospital. You need modern medicine. big intervention. It has the potential for big side effects. But chronic disease, no, I do not believe that modern medicine is the best answer for chronic disease. The majority of deaths that we have are related to chronic disease. 90% of the $3.5 trillion that we spend annually on healthcare, it is spent on chronic health conditions. Yet, we're not making headway. Our diabetes incidence is rising. Obesity is rising. Heart disease, cancer, autoimmunity, all the chronic diseases are up. So success-wise, modern medicine is not cutting it when it comes to chronic disease. Here's another little side issue with modern medicine. Some would say that it's become very impersonal. The old day of, the family doctor making the house call and the doctors knew the patients, it was all different. And now when you go to see a specialist, you're liable to see a nurse practitioner. Next time you're liable to see the physician's assistant. You might not see the doctor for several years. So things have really, really changed, and I don't think it's all for the better. Well, certainly the technology, the modern medicine is amazing, but not all things are for the better. And so I totally see, and I have many patients that feel like this gentleman with the little barcode on his back. That's how he feels. So, even before COVID-19, we were in a state of health crisis. Our healthcare system is extremely expensive. And as I said, we are totally failing when it comes to chronic disease. We spend nearly double the amount of other nations on healthcare. And yet, in terms of outcomes, we rank 37 out of 40. That's first world leading nations, right? Industrialized nations, talking Western Europe, Japan. We're way at the bottom of that list. And yet we are the most expensive. Somewhere in there, we are not doing what we need to be doing. And I think some of it, we can say, has to do with, what's our approach? So this is how medicine is taught. They teach medical students how to make a diagnosis. Once you make the diagnosis, you got a little, you can search the internet, you can look up the treatment. In the olden days, we used to have little books. We looked up the treatment. So basically, what's the diagnosis? What drug does the patient need? And Big Pharma spends billions of dollars each year to make us think this way. Diabetes, hypertension, cholesterol, all of those things translate to prescriptions for life. There's really no motivation in the system to cure anybody. They want to maintain. They want to maintain because, just imagine, it's just a continuous, every month, the patient's got to fill that prescription. I'm going to put a little interactive question for you guys, and I'd like for you to answer that. How do you take any daily prescription medications? Just out of the group here I have. So far, it's looking like I got a group that doesn't take prescription drugs. Okay, that's all right. Switching a little bit, hitting about 50-50. I'll wait another 5 seconds. 66, yes, 70-20, 62-37. Back to half and half. Everybody put their answer in? All right, well, it looks like at least half of you guys are on some chronic, ongoing prescription medication. And, the majority of Americans are, and the majority of Americans are on multiple prescription medications. So, this is straight out of the Medicare manual, okay? If you're sick and dying, then you can receive medically necessary care, is what this says. If you want to improve your health, it's not considered medically necessary. If it's not considered medically necessary, it's not going to get covered by insurance. So health insurance kind of works like homeowners insurance. It doesn't help you to improve or upgrade your house, but it will kick in if your house burns down. You don't want your health to burn down. So it's kind of like my insurance agent said, you're not supposed to use the insurance. So why do we expect health insurance to get us better health? We keep looking upon it. Oh, I have insurance. This should cover me. I want to improve my health. It should cover this. We are trained to think that way. Anything that's not covered by health insurance is not medically necessary. And if it isn't FDA approved, well, it's just not necessary or it's not good. We are very strongly maneuvered to believe this. And it keeps us focused on viewing drugs as the only answer to health problems. And drugs can be life-saving in certain situations, but they all come with a list of side effects. And then, you end up with more drugs to counter side effects of the previous drugs. Drugs do not create good health. Here's a really alarming table that okay, so this is the deaths in the US, the first 29 weeks of this year, okay, because the last couple of weeks, the counts are never accurate, so we kind of cut it off there. First 29 weeks of this year on the left column, 2020, okay, look at that. We have about 1.8 million deaths, okay? That's how many are in the entire country. That's of everything. I'm not talking COVID, I'm talking about just deaths, because we know COVID deaths are not accurately counted, so it's really hard to know. So we compare that with the average over the last 3 years, 2017, 2018, 2019, that's the next bar. You see the average number of deaths for the first 29 weeks of the years was lower. So this year, there is a noticeably increased number of people dying. And of course, we can presume that that is COVID. Whether it's COVID infection or our reaction to the COVID infection, we won't discuss at this point. But I want you to look at the other bars. The next little bar, which says medical mistakes. If you stack that on top of the bar that is next to it on the left, it evens 2020. So what does that tell you? It tells you that every year there are enough medical mistakes made similar to the number of lives we've lost to coronavirus. Every single year, guys. So do we hear about this? Shouldn't we just be devastated every year? Medical errors. Our healthcare system is killing this many people. We don't react to that, but we're totally going bonkers. We've shut down the economy, right? Closed the schools, everything. Because of what? Because we don't want people to die unnecessarily. But yet we keep our eyes closed when it comes to other causes of death, like medical errors. Okay. The other two columns I'm showing you just kind of for what's the total number of cancer deaths. How does that compare? Heart disease. Heart disease still a little blip above cancer, but cancer is unfortunately catching up. And again, significant blip in terms of that, that middle bar. Medical mistakes equal to coronavirus, roughly, guys. We totaled up the numbers, and yet nobody's saying anything. That just to me is just mind blowing. So let's get into integrative functional medicine, okay? Now I said we're not talking acute care. You're in a car accident, you do not want to track me down and want your integrative functional care. You want to go to the hospital. But for chronic disease, okay, what is it? Well, it starts with good medicine. Cause. It finds it and it addresses it. It's a holistic approach that acknowledges that the whole is greater than the sum of its parts. It is preventive. That means it anticipates and it forestalls disease. And under my picture there, best practices. It combines the best practices from all approaches. So that means, hey, we believe in acupuncture, right? We believe in chiropractic. These things, these modalities are all useful. So when you integrate, you are integrating a combination, okay? So looking at depression here, you get one condition, but tons of causes. And by the way, depression is not a Prozac deficiency. Okay, so a lot of things go into this. Here we are, social isolation. No wonder we're all depressed. Okay, vitamin D deficiency. You wouldn't think of that. Okay, and unfortunately, it's still not something that is routinely tested by doctors. Prediabetes, autoimmunity, omega-3 fatty acids, right? Because most of us have too much omega-6 on board. Antibiotic use. That's probably because antibiotics upset those 4 pounds of bacteria we have in our guts, the microbiome. The microbiome has effects on our mood, okay? So depression, one disease, lots of causes, okay? You have to see which one, not throw a drug at it. It's not a Prozac deficiency. It's all of these potential conditions, okay? Then one cause can cause many diseases. You've got chronic inflammation that can branch out and cause everything from cancer to arthritis, autoimmunity, heart disease, inflammatory bowel disease, okay? So this is where functional medicine comes in. It's looking at root causes, okay? Getting to the root and a cause, and it wants to address the root cause, okay? That's key with functional medicine. The other thing functional medicine realizes that it's really, you can't just blame it on your genes. Just because diabetes runs in your family does not mean that you have to resign and say, I'm going to be diabetic because it runs in my family. 80% of the effect you have control over. It is environment. That means it's what you eat. It's how you manage stress. It's where you live. It's if you exercise, okay? All of these things. So the environment really, really trumps genetics when it comes to chronic disease. And we do not want to just basically sit idle and say, well, you know, my mother got dementia, so I'm going to get dementia. No, you need to step up and make some changes so you don't go down that path. You've got more motivation if you have a family history to make up for that, okay? I really like this picture. What's it showing you? It's showing you that there's a sink open in the back, all this water's pouring out, and you've got doctors there mopping up the water. So mopping the floor, but they're not turning off the faucet. You can see that the first thing that should happen is turn off the faucet. And then, yes, mopping the floor is important, okay? So this is where kind of functional medicine comes in, gets to the root of the problem. The root cause here is you've got an open sink and it's overflowing. So you turn that off. That's what functional medicine would do, okay? Now, our conventional care model is, well, you've got it now. You're depressed, so let's find a drug for it. So it's there. So we're going to just mop it up. We're going to mop it up with, you know, maybe we'll keep inventing all kinds of vacuum mops and stuff so we can be more and more efficient at mopping up the water. But we're not turning off the faucet. That I find is a really good analogy for what's going on. I guess in 2020, I can't skip COVID and do a webinar. It's the elephant in the room. And this is the health issue that has locked some people in their homes. They're completely isolated. You know, I think the poor people in the nursing homes, in the care facilities that were just isolated, they were locked in their rooms for a while. They were not allowed out. I can't imagine. I thank God my parents are already with God and they didn't have to endure any of this. You know, needless to say, there's just been tremendous stress as a result of this. The economic disaster, you know, it's just going to leave us in bad shape for a long time. Okay? So have you or anyone you know personally been sick with COVID? And I had one person answer that already, but I would like to know how many here in the presentation, how many of you guys know anyone? Yeah. The majority. And there are those that say it's a hoax. I don't believe it's a hoax. It's a real virus. Its origins, of course, are debated, but it's a real virus. So 61% say yes, 38%, 64%. So more than half of you guys know someone that's been sick with COVID-19, and I can say that I too know somebody sick with COVID-19. So with this COVID-19, then clearly the approach that we have taken hasn't been fully successful. And while the virus has claimed some lives, I really feel that our response has claimed a lot of lives as well. That peak that we had in April, May, that was not a natural viral peak. Okay, so the standard, CDC and World Health Organization recommendations, you see those listed there, right? And really it's all about do all this stuff and wait for the vaccine. That's really what it is. It's do this, we're going to bring out a vaccine. But then as time passes, we hear, well, the vaccine will consider success if it's more than 50% effective. They're not expecting it to be any more than 60% effective. Okay, there's of course a bunch of different vaccines out, but the whole idea, it's almost like the world's on hold until we get a vaccine. But wait, the vaccine isn't going to be fully effective, and we're rushing it, so the vaccine might have side effects. So please, let's make sure that not only in America, where people can't sue vaccine manufacturers, we're not allowed to. In Europe, they're trying to get that passed too. So Europeans, they can't sue vaccine manufacturers either because they're going to put forth vaccines that maybe not be safe. So there has to be another way. And that's where I am going to kind of slowly guide you guys. Obviously with the current issue, people have died of heart attacks because they're afraid to go to the emergency room. People can't get into their doctors. People's cancers have progressed because they can't get proper care. The financial crash, the stress related to that, stress we know affects virtually every chronic condition that we have. So what has this experience with COVID taught us? Well, it's taught us that most of us who get sick with this are sick to begin with. We have an underlying condition, 90% of the time. So it's rare for somebody to get sick without having a previous underlying condition. And those include obesity, diabetes, high blood pressure, heart disease, lung disease, those kind of things. Obviously, any kind of an immune compromise is going to get you, okay? So there are criteria for high risk, okay? And you see those listed there. And I want to just kind of mention, they're all pretty obvious. Diabetes, I was saying at the beginning before we started the webinar, is really, really for this. So for the diabetics, it's really time that you take charge of your diabetes and you work to turn your health around. There's been a push for everybody to get the flu vaccine because, flu season's coming up. And the concern there is that there is some data that suggests that the flu vaccine might make you more prone to get some sort of a COVID virus illness. Okay, this is on the basis of a big study done in the military a couple of years ago, and they tested people that had gotten the flu vaccine and those that didn't, and the ones that had the flu vaccine were more likely to develop colds and respiratory infections by coronaviruses. So obviously COVID-19 didn't exist then, but there's some concern that flu vaccine could potentially increase your risk. But of course, that's not what is in the press. They're saying they're pushing the flu vaccine. The low vitamin D level, that's all not in the press, and I've tried to put it in my press. I'm getting it out as much as possible. Anyone with a low vitamin D, huge risk. We need to fix it. We need to fix it fast. So, nobody's addressing this increased risk. Nobody's addressing simple things that we can do. This is the time for innovation, for looking at overlooked therapies. It's the time to look at the weak immune state of our population and work to improve it. Viruses are always going to be with us, and new ones will keep evolving, and this one will probably keep mutating. There are many potential treatments. Should we just be looking at investing billions in drugs and vaccines tailored to one virus, which will soon become irrelevant because there'll be a new strain or a new virus? Or should we focus on strengthening our immunity, calming our inflammation that leads to the cytokine storm, and pursue therapies that have a broad spectrum of action? This is what integrative functional medicine is all about. Okay. My next question to you is, do you have more than one risk factor for COVID-19? So I'm going to put that poll up here next. You know, a lot of people, obviously, if you're above 60, yeah, there you go, you got one. So I'm saying more than one. So that means you have another underlying health condition. Yeah, so it looks like close to 50-50. So, you want to address all of these. If you've got lung disease, you want to optimize your lung condition. If you've got heart disease, you want to make sure everything's under control. Okay? You got the diabetes, you got to make sure that's under control. So it's like we have 60% with just one risk factor and 38% with multiple risk factors. So it is not unusual that we are a sick population. So here's kind of where we want to go. We are on the left, the little fish trying to jump out of there. What's the current strategy? Well, we're going to vaccinate the fish. Okay. But nobody's looking at cleaning up the terrain, cleaning up the fish tank. And that's what I mean about decreasing your risk factors. Okay. We want to, if we have a great vaccine and it's safe, we'll use it. We want to use that. But if we have a dangerous vaccine and we can get by cleaning up the terrain, maybe we want to do that. So combining the two is going to work far better than one. If you leave that fish in the dirty tank, that fish is never going to be a healthy fish, no matter how many vaccines you give it. And that's what we need to understand. We're never going to be as healthy as we can be, no matter how many drugs we take. In general, the more drugs we take, the less healthy we are. So let's talk about kind of going forward and how can we change things. So lifestyle, okay? This is one major thing we work with patients on, really key, and that's going to include everything that I'll list on a subsequent slide for you, how we approach that. But, what you eat, what you do, how you live, that's key. Nutrients, botanicals, make sure you're not nutritionally deficient. I'll show you a chart where it shows you that most of us are, okay? We talk about reversing diabetes, not just maintaining it and adding medications. We'll talk about integrative therapies like Ozone. Some of you guys are familiar with it from my practice, like intravenous vitamin C. I'll mention something called Plaquex. We'll mention an allergy therapy called LDA. I know some of you are familiar with. Okay, so what we're looking at is a holistic approach. Okay, look at the person as a whole. Because, if I'm very stressed and if I'm pregnant, when my child is born, my child is much more likely to have illnesses because I was stressed during pregnancy. And if I am stressed, I'm much more likely to have any kind of illness, everything from cancer to heart disease to autoimmunity. I have a friend who lives a very stressful life, and I keep getting these phone calls, her shingles is reactivated again and again and again. And it's just your immunity gets you down. We're going to dig for the root cause because we're going to turn off that faucet. We're going to optimize your body's functioning. Make sure your metabolism is optimal. Make sure your detoxification is optimal. Okay? We're going to cut inflammation, improve your energy, reverse that diabetes. All of these physiological processes and our foundation are the pillars of health. Everything from nutrition, fitness, your body's ability to detoxify, because we are living in a chemical soup. the air we breathe, the water we drink, the food we eat. Our hormones are out of whack because we're exposed to so many toxic chemicals that damage our hormone functions. Neuroemotional. We are more stressed than any time in history. This is a slide I've shown before, and if there's nothing else you guys remember from this presentation, please remember this slide. It says you can end the pandemic, decrease the risk of severe disease 90%. Decrease the risk of dying from COVID-19 96%. Guys, if those numbers don't floor you, I don't know what will. Answer simple, take vitamin D. You're not hearing about this on Fox. You're not hearing about this on CNN. This should be front and center. I just saw a patient today. She had a vitamin D level below 7, so low the lab couldn't measure it. It's like, okay, we're going to get started right now because that's a dangerous level. Okay, so you need to know where you are. Okay. So know your D level, how to test your D, okay? We can help you, even if you don't have a doctor and if you don't have insurance, you know, I think for $30 we can help you get your vitamin D level checked. So reach out to us, okay? The website, call the office. If you have any questions, we will help you with that, okay? So, you know, we talk about energy. If our mitochondria, the little energy producing factories in our cells, are not working, right? Nothing in our body is going to work right. And so, you know, fatigue is a very common complaint anymore. And so the standard approach is what? A blood count, they check for anemia, they do a metabolic panel, make sure your liver and kidneys working, and they do a TSH, a pituitary hormone that controls the thyroid, and they are looking for a thyroid problem. That's basically what you get. When that comes back normal, they tell you there's nothing wrong with you, you're depressed, or it's COVID stress. Okay, so when a functional integrative doc looks at you, we're looking at, you guys know, those of you know me, you've seen me, I do a bunch of testing, but I only test for things that I can impact, okay, that I can help you to impact, basically. So we can look at heavy metals and at adrenal stress, okay, looking at a comprehensive thyroid panel. You know, my initial battery of thought for thyroid is at least 7, sometimes 8 things that I look at. Okay, not just TSH, and I'll explain why. Steroid hormone panel, okay, I want to know what those poor hormones are doing because there is so much hormone imbalance. Testing for chronic infections, again, huge problem because our immunity is so low. Okay, so looking at this chart, this is from a few years ago now, but if you look at this, this is from 2009. The 100% is at the top, and each bar represents a particular nutrient, a mineral or a vitamin, okay? Look at how many people are deficient. Vitamin E, more than 80%, okay? Look at calcium, look at folate, look at magnesium, look at vitamin A, okay? We are mega deficient, and when I tell you, you don't need to take vitamins, you just need a healthy diet, well, if we had healthy food, that would probably be correct. So looking at thyroid, as I said, I personally had a thyroid problem. It's near and dear to my heart. Thyroid controls every cell in your body. It literally controls the rate of your metabolism. And so every single cell in your body is a receptor for thyroid hormone. And so it impacts function. And it can impact just about everything. And the next thing that I want to show you is this slide tells you how many things impact thyroid function, okay? And it's showing you T4, T3, RT3 in the cell. It's not even showing you TSH. So if you just measure TSH, you're not going to pick up a lot of things that influence thyroid function. And so this all gets, so those of you guys with chronic fatigue, it's really sad. As I said, I almost, my life, basically, I lost everything I had just about, had I not been properly diagnosed. And so, I know what it feels like when every single step you take requires a sheer act of willpower. Going on fatigue, the thyroid, as I like to say, basically it's the thermostat of your metabolism. The adrenal is the furnace, okay? So medical science does not recognize adrenal fatigue, and that's why I call it the adrenal fatigue myth, okay? Complaints are often due to a treatable condition. Avoid unregulated formulations. What do they mean by that? Supplements. So this is standard conventional medicine's approach to adrenal fatigue. They say it doesn't exist. Look for other treatable conditions and don't use unregulated formulations. So I have one other little poll question for you guys about this. Oh, looks like we didn't end the last one. Let's reset. Have you heard of adrenal fatigue? Yeah, I'm thinking this group knows about adrenal fatigue, but if you mention it to your primary care doc, they're not going to agree. They're not going to agree. So it looks like about half and half. 44% have heard of it, 55% have not. So I'm going to explain this to you very briefly because that will let you know if you think you might suffer from it and you might want to be evaluated. Okay, so it looks like more than half, 55% have not heard about adrenal fatigue. So let's talk a little bit about this. First of all, I want you to be careful. I don't want you to call it adrenal fatigue, okay? So please don't call it adrenal fatigue. Let's be fancy and call it general adaptation syndrome. Adaptation to what? Adaptation to our environment, to stress, to life. Adrenal fatigue is not the same as adrenal insufficiency, which means your adrenal is not working. This is a conventional medical medicine recognized condition. By the time they recognize it, you can't get out of bed. Every time you stand up, you get lightheaded, your blood pressure falls. You have to be that sick to be diagnosed with adrenal insufficiency. General adaptation syndrome, no, you can be still living, not very happily, but you can be living. So let's talk a little bit about what goes into that. So this is a example. This is one of my patients. So you're seeing kind of a gray zone, the patient's results up above it. This is a patient that is in the morning, has a high cortisol level, stays high, kind of starts coming down, and then at midnight. Cortisol varies with the day-night cycle. This is our stress hormone, okay? If you only measure it one time and you bring some needles at somebody, you're going to raise their cortisol level just by doing that. And then the patient or you is not going to have an accurate reading. This way we give you a saliva test. You take it home, you spit, you don't get poked with a needle, and then we can see what exactly happening. I'm going to give you the next example. Excuse me while I grab a drink of water. I'm getting a dry throat here. So this patient does not have an elevated level in the morning. In fact, this patient is too low. And so this patient's got not a flat line EKG, but a flat line cortisol curve. The first slide is more of an acute stage when you have a patient that has been stressed for a period of time and they are in this, their baseline resets and they just make too much cortisol all the time. They can't calm down. They are wired and tired. This patient, on the other hand, is just kind of petered out. This patient is just tired. And so this is a more extreme stage. It's been around longer. Quote from one of my patients. This is Michelle. Literally within 2 months, okay, our aches and pains went away. This was by simple thyroid treatment. I optimized her dosing, okay. Her pain went away, her energy level got much better, and the weight came off effortlessly. That's kind of the key there. So when you support the body properly, but you really have to dig deep to get there, okay? Let's talk about diabetes briefly. okay? Because the diabetics out there, guys, I'm worried about you, your loved ones that are diabetic. You need to really take charge here. So there are some basic myths, okay? The one is diabetes always gets worse. Once you have it, that's just, it's going to go down that slippery slope. You're going to go from one medicine to two medicine, diet control to one medicine to two medicine, three medicine, end up at insulin. Okay, that's, where that goes. You end up with complications. You get neuropathy. Your feet are constantly in pain. It's hard to walk. You risk losing your feet because of a circulation problem. You risk dying of a heart attack. You risk going blind. It kills unless it drew out with a heart attack or a stroke. So the CDC says diabetes is preventable and controllable. Again, they want to control it. Okay, I want to tell you that it can be reversible. Early on, it is very reversible. When you get extreme and by then you've burnt out your pancreas, yeah, we're going to have to manage that. But you know what? We can really lower the insulin requirements and make things much, much better. Okay, so it is reversible early on and it can be much better later on. The second myth is it's genetic. Again, it runs in your family. Geez, I got lots of relatives with it and you have to learn to live with it. Wrong. Again, I said that before. 80% is lifestyle. It's environment. So lifestyle trumps genetics. Myth 3 is as long as you take your medicines, diabetes isn't a big deal. You're going to be okay. Do you really believe that? Do you really believe that? Because the medicines don't prevent complications. We know that. Conventional medicine knows that. So people who are suffering with neuropathy are usually on several drugs. The drugs didn't prevent it. And then their kidneys start to go out. Okay. And then the diabetic medications raise your cholesterol, and the cholesterol medications make you more likely to have diabetes. So you kind of end up in trouble. So how do we defeat diabetes? Okay, so I'm working with a patient, it's highly individualized. Every patient has kind of their own plan. Okay, we teach you how to control insulin surges. That's before you are on insulin. We teach you how to resensitize insulin receptors. We're going to do that through proper nutrition. Optimize your thyroid and adrenal function, very key. Okay, and again, if you don't address it and doesn't believe in the salivary cortisol test, they'll never pick it up until the patient is horizontally sick. Okay, thyroid problem, as I said, I almost lost everything as a result. And I know many of you out there, or people who think they have a thyroid problem, but the doctors just won't diagnose it. We've got to cut inflammation and remove toxic sources. We've got to correct the leptin resistance. As we do that, the diabetes will reverse. But you need someone to help you do that, okay? There's a lot on your own you can do, but if you're on diabetic medications, make sure your doctor's following you along so you don't get hypoglycemic. That can be deadly. So be very careful making changes yourself, okay? Then I want to talk a little bit about some integrative therapies. These are the other things that we do. We want to talk about intravenous vitamin C. Some of you guys know this because, again, you have seen me. Ozone therapy, prolozone, those. And when I introduce to these therapies, they are available. UBI, photoluminescence, also known as ultraviolet blood irradiation, sounds kind of scary. Plaque wax and LDA. And I'm going to briefly give you guys a little information on that. And we'll start with vitamin C. Vitamin C right now is really huge. For a while, we couldn't find vitamin C at the stores because everybody was buying it up, right? So let's start with vitamin C. There is a group of critical care doctors. Critical care means intensive care doctors. They manage patients who are in ICU, okay? They've set up this frontline COVID-19 Critical Care Alliance. And they have developed what's called the MATH Plus protocol for treating hospitalized patients. Now, the NIH, National Institute of Health, they have their own guidelines for treating COVID. The Frontline COVID Alliance, Critical Care Alliance, these doctors have come up with a very different protocol. okay, from what the National Institute of Health tells you. And I think I've talked about this in a previous webinar. These doctors have no commercial biases, and I will tell you that they are sincere, they live this, they do this, and they're doing it now in the US and in various countries. But unfortunately, a lot of people do not have access to these doctors because it's not consistent. Most doctors are just following what the NIH says. So the Math Plus protocol has medications, and look at that, it has vitamins on it. Ascorbic acid is your vitamin C, that's the second one listed there. Thiamine is one of the B vitamins. You see zinc, vitamin D, magnesium, melatonin listed there. Okay, so this is what the doctors have come up with. And if you go in the hospital, if you are sick with this, terribly sick, you can say, hey, please follow the math protocol. But your doctors are liable not to know the math protocol because the doctors basically stick to the guidelines. And so this alternative exists. You have a right to it. If your loved one's a hospital, again, reach out to me and I'll help you. You can get this conveyed to the doctors because the odds of survival following this protocol are almost 100%, whereas the odds of survival with conventional treatment are not near that if you have an oxygen requirement. So I have a colleague down in the Atlanta area who is a hospitalist. That means he takes care of inpatients and intensive care patients. Using this Math Plus protocol, they have had lots of COVID patients. Their ICUs have been full of COVID patients. They have had maybe 2 deaths, and those patients had so many other diseases that he says, but what can I say? Not really a COVID death. So that compared to hospitals where people, they've got these big trucks out there with body bags stacked all, one on top of another, that's a nightmare. That's what the conventional approach gets you. So guys, be educated. Math Plus protocol. If you or a loved one is sick, reach out to me. I will help you. Okay. This is not something I do in the office. So please know that we don't, reach out early so that you don't end up going in the hospital. Okay, that's the whole idea. So first sign of symptoms, first question, that's when you want to react. You don't want to get sick. Okay, so very early on out of China, there was data about vitamin C IV treatments being treated. And of course, the Math Plus protocol includes that, but our standard still does not. Our NIH guidelines still do not. There's no evidence for vitamin C, so don't use it. And I will tell you, there are over 64,000 published studies on vitamin C in PubMed. Okay, not on COVID-19, not that many, but there are many. And against other viruses, tons of other viruses. Again, it's not a virus-specific effect, so it's going to help the immune system take out whatever virus. Here's EBV, chronic fatigue virus is another name for it, I like to say. This is the monovirus. High-dose vitamin C helps that, okay? This is IV vitamin C inflammation in rheumatoid arthritis. IV vitamin C for rheumatoid arthritis. Look at that. It lowers the inflammatory markers. It helps patients' pain get under control. Again, not what your rheumatologist is going to prescribe, okay? Pain. It helps pain. And here we talk about inflammation, and then we're talking about cancer patients. Very useful for quality of life improvement in cancer patients. I'm not going to say, and it is not a standalone cancer treatment, but it will help cancer patients improve their quality of life, and it can go hand in hand with conventional chemotherapy. But the oncologists, most of them are uncomfortable using it, and so they do not allow their patients to do that, which I think is not good. So let's move on, talk a little bit about ozone. Ozone it's that smell after a thunderstorm. You go outside and it's kind of that thunderstormy smell. You're actually smelling ozone. Oxygen, regular oxygen that we breathe in the air is O2. Ozone is O3. When electricity hits oxygen, some of that oxygen turns into ozone. Ozone doesn't stay around for too long. That thunderstorm smell goes away too. It oxygen, okay? But while it's active, there are amazing uses for it medically, okay? Again, conventional medicine does not go there. Why? Because you can't patent a natural substance, and you can't, so there's no studies, there's no drug development, there's just a bunch of docs out there doing literally miracles with it. And I can truly tell you, before I started these integrative therapies and now, I don't know how I ever helped any patient. These things are so powerful and they make such a difference. So, it makes you, gives you more energy, makes you feel better. Your body functions better. Okay. It's really that simple. And there's many different ways that we give ozone. Okay. Here's a study talking about its use in diabetes and spinal pain. Okay. Pretty cool stuff. It helps diabetes. Okay. It helps necrosis. Okay. Here's a couple of patients, again, their comments. After 4 treatments, I noticed brain fog was pretty much gone. I also noticed less exhaustion, but not rush, at natural level of energy. We can take this ozone and we can inject it, okay, into the body, into joints. We can put it into soft tissue, okay? So we can relieve pain with it. It's amazing. Never seen anything like it. You know how the orthopedists give like a steroid injection? Here we're using growth factors and we are using activated oxygen or ozone, and we're injecting that right into the body. Has an amazing therapeutic effect. Okay, things like plantar fasciitis. It's almost a slam dunk with this. Okay, chronic neck pain, chronic back pain. Okay, knee problems. Okay, other joints respond very well. Some patients require 1 injection, and it's a miracle. The majority of patients need about 3 to 5, and sometimes we actually combine this with platelet-rich plasma. PRP, it's otherwise known as. So amazing for focal areas of pain. And if you have anything, again, the discovery call is free for you. In that, I'll be able to tell you if this is an option for you, okay? So this is a study. Again, this is published, Medline guys, right? Conventional medicine. But again, your doctors have never heard of this. It's in the medical literature, but there's so much in the medical literature, there's no way every doctor can read every article. It just is not humanly possible. So this is a knee osteoarthritis, okay? It helps, it's effective for chronic pain management, okay? Some people don't have to have their knees replaced as a result of this. After years of pain, I finally feel relief. This fella had so many problems when we first saw him that he would get tired. His energy level was so low, reading. Okay, he had so much pain at his elbow, which he had operated on, that he could not pick up the TV remote without pain. So we injected that. I think he got 2 injections about a month or 2 months apart. Amazing. He was doing, basically, he was, doing things around the house, fixing things, not just couldn't manage the remote. So amazing. I'm going to share with you a little video also of a patient of ours who has, who underwent prolozone for her knees. So this is Michelle.
And I had a hard time even walking. Going downstairs was terrible. I had to go 1 step at a time, like I was like 90. And going uphill was really bad. It just hurt. It was just getting to the point where it hurt all the time. So I received 1 shot, and it has, I would say, 75% to 80% better. Still hurts if I go on a long hike uphill, but it has been a miracle. So I love it.
Next treatment I want to mention is, and there's a wonderful article that summarizes this called The Cure That Time Forgot. This is ultraviolet blood irradiation, or photoluminescence is the other term for this. And this basically is ultraviolet of your blood. We actually take a little blood out and we run it through an ultraviolet light and give it back to you. All sterile, all closed system. And that ultraviolet light exposure of the blood has tremendous therapeutic benefit, both in terms of helping your immune system fight infection, as well as in calming inflammation. Okay. And we sometimes will combine this treatment with the ozone therapy. So that's also again, a novel, very safe, amazing therapy. The next one I want to mention is called Plaquex. Okay, sounds like quack quack, right? So Plaquex therapy, it's an intravenous therapy. It improves and restores vascular health. It is a safe treatment that is used to remove fatty and hardened plaque that's built up in your arteries, what we call atherosclerosis. It works to remove plaque deposits from the arteries, which acts to treat and even reverse heart disease. Plaquex will improve circulation, improve kidney function, it will improve memory, and it can even enhance potency. The removal of the plaque from around the heart and the arteries reduces the risk for, obviously, serious disease. And this is, again, done as an IV treatment that also can lower cholesterol as an anti-aging treatment. So this is for someone with established atherosclerosis. Again, conventional medicine for that basically will go in there and rotor-rooter, put a stent in, things of that nature. Other than that, they do not have a systemic therapy. Chelation was also something, and that is still used. Again, try to get a systemic effect. But conventional medicine really just simply wants to mechanically. And again, if there's a focal blockage, great. But usually atherosclerosis is everywhere. It's in every system. So let's talk about LDA. Some of you guys know LDA. And I tell you, this is this gentleman he's living, I think, mostly in Italy. He goes back and forth, at least before COVID he did. Has had just amazing, and kind of really gotten his life back as a result. Sinus infections, choking episodes, things of the past. So it can be, again, a very powerful treatment for allergy. Standard approach for allergy, basically take allergy medicine and get weekly allergy shots. The other problem with the immune system, where allergy is, allergy to things outside of you, if you're allergic to part of yourself, we call that autoimmunity. And the only conventional treatment for that is immune suppression. But when we take an integrative approach, we work on lifestyle, we work on nutrition, we use botanicals, we use LDA, okay, and I'll show you what kind of things LDA can help with. And we use immune balancing therapies. That would be the UBI, ultraviolet blood irradiation, it would be ozone, it would be the intravenous vitamin C. Those are the things that we can use to help balance the immune system. So if you look at this list, it's pretty huge, things that can be benefited by LDA, okay? And LDA typically has been given with an injection. We also, in people with that don't like needles, and in children, we will also administer it as it drops under the tongue, so there's no needle involved. And so this can also be, nothing works 100% of the time in 100% of cases, but I will tell you these therapies are extremely powerful. What are the advantages? Well, with autoimmune diseases, sometimes we can make a rheumatoid arthritis and inflammatory arthritis, eczema, hives, food allergy, okay? Anaphylactic allergy, it helps a bit. Can you go back, and if you are allergic, unlikely, but if you get a little exposure, you're likely to be okay, okay? And then the other cool thing is we don't have to do tons of testing for LDA. So weekly shots versus LDA, big difference. We're looking at every 2 months for a year, and then less often versus every week, and then 3 weeks forever. A lot of people with LDA don't have to do it forever. The effect is lasting. We can treat food and chemicals, which you can't with the weekly shots. So big advantage for LDA over that. So thank you guys for listening. Boy, am I prompt. 8 p.m. I'm going to take all the questions, so I'm going to switch to the chat.